George Fu Gau, probably not saying that right. He was a participant in that event, and he comes from China, where he is the Director General for the Chinese Center for Disease Control and Prevention, professor in the Institute of Microbiology, Chinese Academy of Sciences, president of the Chinese Society of Biotechnology. But when he participated in this event, he brought up a scenario and a question that he presented to the group, which I find to be very interesting considering today's climate. And now, recall, this event took place October 18th, 2019, and this was 3 weeks before the first outbreak in China. Let's take a look at his question, his concern.
You know, we have more cases in China and also death cases reported, and also my staff told me that because there's misinformation and there's some belief, people believe, this is a man-made, some pharmaceutical company made the virus. So there's some violations and even, deaths because of this misinformation. As a, from the CDC, and I don't know if Steve agree with me, when you are doing the field work and you like to do some so-called TOT, training of trainers. So we really need to train the health workers, especially health care workers, their access to the patients, to the public. So make sure they got the right information. So not necessarily, sometimes the health care workers, they know something, but if they are not well trained, they might give the wrong information, but also they might say something, oh, I don't know. Even I don't know, that could hurt. So when I remember such a situation reminded me. When I was in Sierra Leone, and I was interviewed by radio, the national radio, I was asked by one of the audience to say, okay, we believe Ebola was man-made. It's transported from, somewhere. So I think this is very important. We do the TOT. So make sure the healthcare workers have the right information. Okay.
George's fears have come to fruition as it is now believed or suspected that it came from a Chinese lab, the COVID-19 virus. And it's being investigated that it possibly came with the help of the U.S. government. China was granted $3.7 million to the Wuhan lab to study. This was in 2015 under Dr. Fauci. And even after a 2014 moratorium was put on grants to China for any viruses, in 2015, $3.7 million was granted to a lab in China under Dr. Fauci. So, interesting course of events.